Hey everybody, this is Dr. Monica Du, pediatrician here. Today I'm going to go a little bit deeper and I am going to be discussing constipation. Now, constipation is a very common ailment that many pediatricians see daily. We see it in newborns, we see it in older children, toddlers, young adults, and even you and I sometimes can have issues with the passage of very hard, bulky stools. Looks like little pebbles, very like rock solid, hard stools that are just difficult, very difficult to pass. This will be my part one of constipation where I focus mainly on infants. Now, just to give a little background information, infants usually have about 4 soft stools per day in the first week of life, and then as they get older, the number may decrease to even about 2 to 3, especially for infants that are starting on solid foods. Those numbers can decrease because the more solute we put in our tummies is the more time it's going to take to be digested and the more it may start to become a little bit more bulky. So that's important to note, that changes in our diet definitely reflect the stools that we will have. Now, infants, when they're constipated, you'll often see them just straining, having a very difficult time. Their face may turn red. Their abdomen may become a little bit distended because of the stool in there. They will just seem like they are having just the most difficult time to pass that stool. And that is very common. I don't think many people know that, but it's very common for little infants to seem like they are having very difficult times passing stools. It's often because the abdominal muscles are not very strong like yours and mine, and the position that they're often laying down flat. It's not the best position to have a passage of stool like you and I when we're, sitting upright. So it just makes it very difficult for an infant. So it's very common to see an infant appear like they're straining. But like I tell my parents all the time, the golden test is not how they are appearing, but what comes out. Is it soft or is it hard like pebbles, hard like a rock? If it is soft, they're not constipated. They're just learning the skill of passing that stool and working against their weak abdominal muscles to get it out. So that is very important to keep in mind. Now, how about some of the things that we can do to ease the pain of constipation, ease the stress for those little ones? For the infants, you want to go ahead and do some bicycling of their legs. So take their little legs and just gently go back and forth, back and forth, back and forth. And that just helps to coax some of that stool down. It's putting a little bit of soft pressure down in the abdominal cavity to help push that stool out. Second thing I love to do is a little mild abdominal massage very lightly. You don't want to press hard. And what I like to do is follow the flow of their anatomy. So I softly go up from right lower quadrant and up in the tummy, go across, following the transverse colon, and then go down, following that descending colon down to the left side so that it can get onwards out and get passed on a little bit easier. So those are some of the kind of manual things that I like to do. And then sometimes some physicians may recommend initiating a little extra water or fluid in their diet. I would start in the infants. I wouldn't go beyond about 4 ounces for the whole day now. So start slowly, do about 1 ounce or so in the morning, and then go ahead and give another ounce in the evening, and that will just kind of help to increase the fluid around the stool and kind of help to get it out a little bit faster. But you got to be careful because you don't want to overdo it with water in an infant because that can cause electrolyte anomalies. It can cause their sodium to drop and that can lead to seizures. So you need to be careful with the water. You don't want to overdo it. So start out with about 1 ounce in the morning and another ounce in the evening, and then you can see how it goes from there, and no more than 4 ounces. Some physicians may also recommend a little bit of apple or pear juice, and same thing, I would not go heavy-handed with it. Just start with about half to 1 ounce, little bit of sip that you can give them, and then kind of see if that helps to initiate it. It's just, the fruit sugars can help to increase some of that stool passage a little bit more regularly. Some even offer trying some dark Karo syrup, but for that you don't want to go beyond more than a tablespoon, 1 tablespoonful for the day. You don't want to overdo it with that either. And then see how it goes, because if you do too much, you can go the other way now. The other way, which means very, very loose stools, and you don't want to do that either. So, be careful with what you're doing. And then, of course, if ever there are any of the red flag signs, as I like to call it, if their belly is very hard, very distended, they are just going beyond 6 to 7 days, no stools, they're just in a lot of pain. If they're having any persistent blood in their stools, these are the times that you have to go to the physician for them to make sure that everything is okay. So definitely keep those things in mind, and then, do the best you can to kind of monitor what they're taking in, especially as I said, for those that you are introducing solids to, be careful, because that can definitely cause some hard stools if you're not careful. So I hope you found that helpful, and I hope that your infant will soon have easier passages of their stool and that everything will be just fine. All right, post any questions you have regarding infant constipation, and I'll be glad to assist.